So this is just a quick tutorial on how to use the iPad for blood consents. So the first thing you'll do is touch the home screen, and then you'll enter the passcode, which will be provided to you in the handouts. It is 201818. You'll see an e-signature icon. Once you click on that, you will log into your usual Cerner login. Okay, so once you're logged in, you will search by patient last name and first name. Don't worry about entering the rest of the information. So here, our test patient's last name is ZZ Test. First name is Eco Test. You simply hit return or the enter button or the search button, and here comes the patient. So it'll have all of the patient demographics as normal. Again, this is a fake patient. And so this is very important that you remember that most patients have multiple encounters in our hospital, and as such, you need to make sure that you pick the correct and most current encounter. So take a quick look before you select either of the encounters to make sure that the one you are actually consenting the patient form is the correct FIN number. So you might just look at, does it end in 89, 86, or whatever your number is, but do pay close attention to make sure that you select the correct encounter, or the consent will not be valid. So for example, if I knew that that was the correct one, although you'll see several different forms listed, the only form that we are going to start using in the immediate time frame is the blood consent form. And so you'll see it there. One of the things that you'll be able to see here is what forms have already been completed. So for this particular test patient, you can see, oh good, for this hospitalization, they already have a blood consent. And so in which case you would look in the record for it and you would not get a new consent for the patient, okay? However, in this demonstration purpose, I'm going to walk you through how to do a new one. So you'll click on the plus sign, you'll find blood consent, you'll click the blue plus add sign, you'll click the right arrow. It's saying you will be asked to sign one form for this visit, so you'll click it once more. And now the beautiful thing is you're actually in the consent. So unfortunately, sometimes we miss components of the consent, or we have the patient sign on the wrong form, or just accidentally forget to enter a particular part of it, and it makes the consent invalid. So the great thing about this form is that it will make you complete every section. So if that's my doctor name, I simply type it in. Whatever it is that you are saying that the patient has a condition for. So let's say the patient is anemic, and that is why we are giving blood in this example. So you simply type it in. If the patient agrees to consent, the answer is yes, and immediately a pop-up screen comes up. So here the patient is able to sign beautifully. You can see it's very easy to do so with your finger. You'll click the blue done button. In terms of the risks, we said see above for risks. That's pre-populated so that you don't have to type in every single risk again. The next field that you'll have to complete is here. So it says name or physician signature, or other healthcare provider who explained the procedure to the patient. So of course you're simply typing in the doctor name again, because he or she is the one that asked the patient to consent to blood. Okay, so again here the patient is signing the consent. You're clicking the blue button. You are printing the name. Okay, so that's all the patient component. So patient signature, patient name is typed. So now the witness is you. So you're signing as the witness, nurse. And the beautiful thing is you don't have to print your name in, because you're signed in under your Cerner profile. It recognizes that that is your printed name, and it pre-populates the rest of the fields for you. So unfortunately, some of the things that we've missed in the past, this electronic form will take care of for you. And that is pretty much it. We have filled out every component. Once I click finish, it's going to submit an error if I didn't complete every component. And it's saying, thank you for completing the form. Please return it to the nurse's station. Each unit will have it stored in a different area. So you're going to click continue, but before you do that, it's saying, what would you like to do with everything that you just did? You need to make sure that you've clicked on save all forms. It is pre-populated, so you can just leave it as such. And it's saying you just did your blood consent form, click continue, and make sure that you pause and see that green circle with a check mark in it that tells you that it's completed. And really that is it. So that the most important things you need to remember are that you pick the correct encounter, that you do complete every component, and then of course this should upload into the medical record in the consent section almost immediately. So it's not a terrible idea to just search in your patient record just to confirm that it is there. Of course, you'll still have to give the blood tags to the unit coordinator for them to scan that component in, but this takes away the risk of accidentally losing or misplacing a consent, so it really is a great and very easy process to do.